This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 41 of a 58-part video series of the entire book. Please visit our channel and review the introductory videos so you have a background information on what the book includes. Part 41 goes into Chapter 9, Lifestyle, and the subchapter is Family Support. You most likely have families who care about your future. It is important to enlist their support and the support of your partner to keep a recovery trajectory on a positive direction. Persons with heart failure need to be protected from influenza, cold virus attacks, so everybody in the family should receive annual flu vaccinations to greatly reduce risks. As soon as the seasonal vaccine formula is released, it is important to line up and take that shot. Next, the pneumonia vaccine is also critically important. I worked in the field of medical product design for many years, and I would train dealers all over the country. One business associate built up a medical dealership in Chicago until it covered a chain of offices in 14 states. He sold that business for $16 million and retired at the age of 38. A few months later, he died from pneumonia because he never got the pneumonia vaccine. As soon as he started to feel sick, he went straight to the hospital, and they could do nothing to save him no matter how much money he had. He died in less than 24 hours. There are two pneumonia vaccines available. One is the Pneumovax, which covers a suite of pneumonia bacteria, and then the other one is the new Prevnar 13. It's also important for family to help with a healthy meal schedule. It does no good if the family is fighting for junk food and not supplying you with what you need to eat. Family also needs to help by not staying up so late and making noise with late-night television. A peaceful home environment is critical to reduce stresses because stresses produce adrenaline, and adrenaline blocks the cellular regeneration of heart muscle and tissues because that is affected by choline. Family members who are supportive can monitor and encourage your exercise cardiac rehab schedule, even when you don't want to. I find it very difficult to go out bicycling in the winter. I have to put on so many layers and gloves, and there's such an extreme chill factor. Yet, I still need exercise for heart maintenance, even though I'm recovered. It's just as important as food. When you see a family member where every member is overweight, you can be sure it is the diet. The type of food, the quantity of food served at mealtimes, all of those things affect obesity. It's important for your family to help by changing all meals to foods that you can eat. They will benefit, and many doctors today feel that it's important, yet they defer to patients' esteem. Many doctors claim that obesity is a disease or caused by some other condition beyond their control. Occasionally that is true. It is not true with 35.7% of the population of the United States. Every ounce of weight on a person's body entered through the mouth. So stopping the cycle of addiction to food will add decades to your life. It's as difficult as breaking free from smoking. That may sound extreme, but that is the way it is. The second stop is to avoid eating killer foods with a high glycemic index. I once designed a bed for obese patients over 850 pounds in weight. I examined a competitor's bed frame and found that it had been bent by an overload caused when a patient over 900 pounds sat down on the edge. I worked for years on designing specialty beds on the side for obesity. Mostly I dealt with wound care treatment and respiratory treatment, but we did market such products, and every single patient that we had contact with had no hormonal problems of any kind. They simply ate too much food. The family was responsible for buying, cooking, and serving wheelbarrows of food. It was not unusual for morbidly obese persons to eat a dozen hamburgers for lunch. Dinner could be 3 whole chickens for one person. A morbidly obese person does not leave the home because they are not mobile. They can't get in a car, only in the back of a pickup truck. So the family has been responsible for the food, salt, sugar, and fats that made them obese. Therefore, it's an extreme example, but your family, even in small things, needs to support you in your efforts at heart failure recovery. Talk to them every day to let them know how much you appreciate their efforts to help. Ask family members to read this book and other books on the recommended list. The more they support your efforts, the more they will benefit by preventing heart failure in their future lives. If one member of the family has heart failure, then it's a risk factor for everyone else. This book has everything to prevent heart failure. All of the enzymes, all of the dietary recommendations apply to prevention. So therefore, it is critical that the whole family participate. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in a print and Kindle edition. It's available from Apple iTunes in the iBooks edition. It's on eBay in a print edition, and available directly from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just send a check for $24 to cover the shipping and handling expenses. Thank you for listening.